Hello everyone, I'm Dr. Talari, and in this video I'm going to talk about communication. Okay, first I'll talk about the importance of communication skills. Australian medical graduates with English as their mother tongue practice hours and hours on how to improve their communication skills. So it's very important to improve your communication skills as English is not your first language. So I'll tell you the significance of communication skills. So what is the use of making a diagnosis when you're not able to communicate things effectively to the patient, or when you're not able to clearly tell things to the patient that he has to, take the antibiotic, or you're talking about a 7-day rule of the pill, or whether you are sending the patient to the hospital, things like that. It's very important that you improve your communication skills. And the most important thing, half of the medical legal problems in the Western world are due to poor communication skills by the doctor. So it's very, very, very important that you improve your communication skills. Okay, what are communication skills? Communication skills are two types. One is verbal, second one is non-verbal. Verbal communication skills are ability to communicate clearly in English, ability to ask culturally and ethically acceptable questions, and the other thing is checking patient understanding during the interview, advising the patient to stop and ask if he or she is not able to understand what you said. This one is not, the last 2 points are not clear-cut verbal communications, but I just thought I'll include them here. But the first 2 points will show your communication skills. And the other most important thing in communication is understanding the Australian culture. So now I'll be talking about non-verbal communication, which is very, very important because the patient and examiner are observing you. And the other thing, the patient and examiner will be observing whether you are interested in the patient. Okay, I'll tell you a few examples of non-verbal communication skills. The first and most important thing is active listening. So active listening, so when you're actively listening to the patient, for example, while you will be, nodding the head, changing your facial gestures depending on what the patient is saying, changing your body language, your mannerisms, things like that, which tells that you're really interested in the patient and shows that you're a good doctor. How will you improve these non-verbal communication skills? So there is no secret. It's practicing, practice, and practice in front of the mirror, and or record your video, how you do a role play or how you do a station with someone, and ask your friend or family member to criticize. Tell them if you were their doctor, will they come and see you? Or tell them to say what you have done well or what you have not done well. So ask them to give a honest feedback, because it is very important that you have someone who will give a honest feedback. Okay. Now I'm going to talk about few overall tips. First thing, do as many role plays as possible. It's very important that you do at least 20 role plays with at least 3 in each, like 3 pediatrics, 3 gynecology obstetrics, 3 medicine, and 3 emergency stations, because it will train your brain to think in that way, and put your brain through that stressful thinking situation at your house rather than in the exam, because exam is already a stressful situation. Don't put 2 stresses on your brain. That will collapse the entire situation. Okay. And always do role plays with the right person. Why should I do with the right person? Very important question. Okay, so I've seen many people doing role plays even after I passed the exam. I've taught lots of these tips to many doctors, even doctors preparing for the general practice exams, few doctors preparing for AMC Clinical exam. And they do role plays as a group of 4 or 5 people who have never worked in the hospital system, or even when they were working in the hospital system, they used to do role plays, and they used to learn the bad habits repeatedly. And they used to do these role plays and go and do the same mistakes in the exam, which was doing more harm than good. So I would advise someone should do role plays with the right person, if you are not doing with the right person, probably don't do it, because you're practicing the mistakes and you're going to do the same mistakes in the exam. And record your role play, and you can think and analyze what is good and what is not good. And the most important thing is practicing in front of mirror. And I wish all these tips have helped you, and I will talk to you in my next video. Thank you very much for listening. Bye.